Hey, what's up guys? This is Dr. Michael Coe from Movement IQ Physical Therapy for the BJJ Body Restoration Project. It's been a while since I made a video, but I thought I'd come by and revisit you guys. So one thing I want to talk about today I just thought of is how are your elbows doing, all right? In relation specifically to arm bars, right? So one thing that I've done in the past is I've been part of the medical team for some of the IBJJF tournaments. And so I've only done about like 3 or so, but there's so many different weight classes, so many different belts. So the number of competitors on a 3 or 4 day tournament can be just astronomical. Right? So regards to other just your normal sprains or injuries, one that I've seen a lot in terms of dislocations is the elbow. I would say the elbow is the most, right? Because you're talking about the arm bar being one of the most utilized submissions within those tournaments, and you have guys who don't want to tap, they don't want to lose, right? So it's just a struggle at that point. So you don't see too many shoulder dislocations. It's the elbow you actually see more often. And if your elbow dislocates, there's actually a good chance you might have fractured something along the way. So if you ever dislocated your elbow, make sure you have a doctor take a look at it. Get an x-ray. All right, but what I want to say is, well, what about the people that have strains at least, right? As you're trying to maybe in training or in tournaments, you fight off that arm bar and then you get that elbow pain, right? So let's go over some quick anatomy. So if I'm looking at the elbow, it's going to be 3 bones that connect. 2 bones here, and then this bone here. This is called the humerus. This is one large bone here. As it connects, you have the 2 bones that connect through here, right? So this is analogous to eating chicken wings, right? You got the thick bone and the small bone when you eat chicken wings. One bone is the only one, there's only one bone that rotates. So it's this radial side. So radial is also the same size as your thumb. This side is called the radius. So the radius, all it does, it's supposed to spin in place as you move your hand back and forth. And then this bone actually doesn't turn and rotate. So there's only one, it looks like both bones are rotating, but it's only this guy with this. This is the only thing that's rotating. It should be rotating in place like this, all right? So if you have limitations in rotation after your elbow strain, one thing you could be doing is, what could be going on is that this thing is no longer rotating in space or in place where it's supposed to, but what ends up happening is there's a restriction that tightens up, and the ligaments around that radial head, this part right here, doesn't want to spin in place anymore. So what it'll do, it'll actually slide or roll out of place, right? It's not enough where it causes dislocation, but it's a dysfunctional motion that occurs within that bone. It needs to spin in place, not roll out of place. So that's one thing that can happen. It's a real common thing, that actually why people get tennis elbow over time, right? Even people who don't do jiu-jitsu, who don't even play tennis, will start getting this outer elbow pain. Oftentimes that radial head moves too much throughout the day and it irritates the tendons that come off of here. So that's one thing that can happen. Now, another thing can happen is this bone here is called the olecranon process that comes off of the ulna, and it's in the shape of a U, right? So there's a U shape that comes into here, and then there's a cave that occurs right here, and so that U part is supposed to go inside of that cave as you strain out that elbow and you try to get that extension or hyperextension. Some people have that double jointedness. So what can happen there is if you try to fight off that arm bar, right, what can happen is either this U doesn't sit right into that cave, it can slowly come off away. It can slowly come off here more to the outside or to the inside. So now you don't have that nice bony prominence going within that cave, right? Now what it does is off to the side, and so it doesn't go into that cave, it comes off and then it gets abutted against other bony parts. Right. So those are two things that will cause a lot of elbow pain or limitations in range of motion after a strain. So if you can get that back, you should be able to get better range of motion and hopefully improve your rate of recovery. Now I can't really give you anything about this. This one takes some know-how and feel how to get that elbow bony piece in. This one's a little different. This is something that you guys can do also, right? So what I mentioned is that there's a rotation and turning in place that needs to occur. So as long as you can make that happen, keep it there, then you got something to work with, right? So if this bone is here, and I want to, let's say what we call palm up, going from palm down to palm up, this is what we call supination. This bone needs to roll this direction, right? But what it's going to happen is if it's not moving the way it's supposed to, it's going to come out this way. It's going to roll and it's going to come out this way. So what I want to do is I want to grab on top here, pull it towards me as I actively rotate my hand. So that's one way you can get and try to maintain that alignment within that bone so it stays in its place and stays spinning in that place. All right, so palm down, holding my fingers onto this radial bone, and I'm pulling towards me, holding it, grasping it, maintaining that pressure, and then I'm going to rotate and turn. Turn, rotate. So let's say it's the other way, right? What if I go from palm up, palm down, and it starts spinning this way, right, towards me? What I can do is now I'm going to put my hand, use this part of my hand, the fat part, I'm going to push towards, in this case, the camera, holding it, pushing this way, and I'm going to go from palm up to palm down, palm up to palm down. Probably say about do 10 to 20 repetitions every other hour if you're having some soreness within that elbow, right? Even if you have actually tennis elbow, so it'll be tendinitis on this outside part right through here, this will actually be a good one to do. So if you even have family members that might be having some elbow issues out here, it will be good. All right, just to let you know, in terms of this is called tennis elbow out here, this is golfer's elbow. It's a different situation, different tendon, right? Both tendinitis and they both suck. All right, so try that, guys, at home. All right, if you have, so here's one thing that you guys didn't go to schools. Which direction do I pull towards me or do I push towards you? The only answer is I say ask me. So if I see you guys at the UFC gym, go ahead and ask me and see if I can kind of give you some leeway. Other than that, it's not really a bad option just to go ahead and just do both, right? Because either way, you're going to be working on making sure that bone stays in place, but you'll also be working on making sure the tissues and the muscles are elastic enough in every direction. And in with jiu-jitsu, you're always constantly turning and twisting your hand in everything you do, so you might as well just do it as a way of doing it in terms of a wellness approach and making sure your muscles move the way they're supposed to. All right. So guys, if you guys like this video, please like it, please share it, ask other people to join into the group. If you have any questions about other injuries or any body parts, let me know. Okay. Thanks, guys.